So welcome everyone. It's great to see so many people on the call today. Welcome to this webinar. My name is Dr. Gary Smith. For those of you who don't know me, I'm the president of the Faculty of Homeopathy. And it's my great joy to welcome everyone today. Thank you for joining us. This event is being recorded and the recording will be made available afterwards. So if you're watching it live today, or indeed if you're joining us afterwards and watching it, I'm very pleased to welcome you. Thank you for tuning in. This is the sixth part of a series of webinars that represents a collaboration between the Faculty of Homeopathy and Vithoulkas Compass. And I'd like to say again how pleased I am to be collaborating in this way and being able to provide sessions such as this. So I'd like to thank our friends at Vithoulkas Compass for their support of the Faculty of Homeopathy. But perhaps at this point, I'll just ask for my first slide to be put up. That would be helpful, I think, if we had the first introductory slide. And as you all know, our speaker today, thank you very much, is Andrew Ward. Our good friend Andrew, well known to us. He is the UK ambassador for Vithoulkas Compass, and he's a busy practitioner, having been in practice for over 30 years in both the NHS and the private settings. He's very busy in homeopathic education as well as homeopathic practice, and he's been dedicated to raising the standards of both over many years. So today his subject will be he'll be presenting a case of a chronic case of Crohn's disease and Proctitis treated with classical homeopathy. And as we know, these are two hugely challenging conditions to treat. And Andrew will be demonstrating how a correctly chosen homeopathic medicine can bring about profound beneficial effects and healing. And in particular, how using the Vithoulkas Compass software can be helpful in choosing the correct prescription and then the analysis and the follow-up prescribing. Next slide, please. One other slide, and then I'll leave it to Andrew. If you've any questions about Vithoulkas Compass, please contact Alina Abati. You can see Alina's email address there. You can have a free trial period or a 20% discount on the purchase of a subscription to Vithoulkas Compass. And if you're a member of the Faculty of Homeopathy, you can have a 25% discount on the software. So I'm looking forward to the presentation today. I hope you find it interesting and informative. Please add any questions that you have to the chat box as usual, and we'll put those questions to Andrew after his presentation is over. And without further ado, I think it's just left for me to again welcome everyone and hand over to Andrew. Thank you.
Yes, thank you very much, Gary, for your very nice introduction, and welcome everyone to the sixth webinar in this series. I would like to also thank Vithoulkas Compass for all their work in making this happen, and the Faculty of Homeopathy for their great support in this series of webinars. Let me just stop that share. So, okay, I see people are still entering. Okay, this case I will go through. It's a rather complex case, as this condition usually is. It's challenging. I will be going through the whole case as it happened, all my mistakes and all, because we make mistakes in the process, and these are important for us to learn from. And we see, because this is not an easy condition to handle. and you have to be very careful. It's a good case because this the first appointment was in 2018 in March, so I'm still in touch with this patient. I treat their family, the children and the husband. So it's a case where I've had quite a long follow-up with this now. So we're looking at 18, 19, 20, 21, so it's 4 years, nearly 5 years of follow-up on this, which is really important in cases to see a long-term follow-up to make sure that this hasn't, relapsed and this kind of thing. And it's very, very interesting to talk to her now, how her life has turned around and changed since this condition has gone, and the creativity of the person, and because she produces very, very nice artwork, and this is all blossomed since this condition has improved. So this is part of what we can say is a definition of health that Professor Vithoulkas has always talked about. It's not just about removing your symptoms of disease, it's about then how much can you develop your creativity in life and your purpose. So with disease and illness, it's very difficult for us to be creative. We're in a condition of ill health all the time. So part of this is to free people up from their problems, and then they can go and do what they need to do in life. So this is very rewarding for us to see this. So let me start. So it was in 2018, a female 42 years old consulted with me for, it had been given various diagnoses, originally ulcerative colitis, and then they changed it to Crohn's. And then at one point they said, well, it's proctitis. So it kept changing. But anyway, she was presenting with this condition, which had been there for 9 years. She'd been suffering with this. And mainly she'd been treated with prednisolone and mesalazine, which are standard treatments for inflammatory bowel conditions. And as I said, the more recent diagnosis was Crohn's stroke proctitis. Her symptoms were fairly typical. She had tremendous tenesmus, which is meaning very strong, painful urging, sudden and severe urging for stool, very frequent. Mainly sometimes stool, sometimes mucus, sometimes wind, and a lot of blood being passed. Also, it wasn't uncommon for there to be involuntary stool passing with bloody mucus, the blood being sometimes bright, sometimes darker. So it was a very embarrassing condition, not being able to manage to get to the toilet on time, and then there'd be an accident. Sometimes stools would be small and hard, sometimes very loose, sometimes it was just gas, mucus, and blood being passed. She had noticed that gluten, which is a very common irritant in inflammatory bowel conditions, was aggravating her condition, and dairy, so she was avoiding those, but still the condition was there. Also, she had a history of 2 anal fistulas, one of which was still there. One had been operated on, then another had returned with soreness and a pulsating pain with sometimes discharge, greenish discharge. Also, she had one rectovaginal fistula, which was also still there with a symptom of wind escaping from the vagina. So altogether, a very difficult situation to be handling. Now, the story of her case was, this had been going on for 9 years. She had developed acne in her 30s when she was 33. So this was just before all of this started. And she was given antibiotics for 3 months in 2009. So that was the first thing, possibly disruptive to the bowel flora. And then also in 2009, she had a very bad accident at work and fell. This led to a very bad dispute with the company she was working for, and a rather nasty legal battle to try and get compensation. She felt very cheated and that it was a very unjust situation. And this had happened also, she'd had in 1997 a traffic accident, and she ended up with a dispute with the police who didn't believe her. So there was some history of unjust treatment. She then said that this injustice was a big issue for her. Things have to be fair. The accident at work caused major back problems, and she was then given non-steroidal anti-inflammatories. And during this period is when the inflammatory bowel condition started. So we have a mixture of things. We have antibiotics, perhaps disturbing the flora. We have the accident, the disputes, and then the back problems, and then the anti-inflammatories, which can also, as we know, disturb the gut. Then in 2010, also she was pregnant and had a miscarriage, which led to an infection and then a blood transfusion and antibiotics, of course. She was also then put on azathioprine, which is a kind of immunosuppressant drug for what they described the colitis, and 150 milligrams daily. At this point, this had been reduced to 100 milligrams. She had 2 children, both cesareans, and she said this bowel condition was worse in the last 3 months. It was beginning to get even worse, despite the treatments. Her acute illness and fever history, which we like to know what the prognosis is with a patient. And this we know, I've talked before about Professor Vithoulkas's levels of health, which helps us very much in understanding where somebody's health is and what potential they have for cure. In the higher levels of health, we have much more potential, better prognosis. In the lower groups of health, much less, much more difficult situation. So the question we always need to ask is about acute illness and high fevers to indicate whether the person still has a good level of health. And she'd had 2 influenzas with fever in 2017. So shortly before all this started, but nothing since. So you see how things had worsened by this point. After all this that had happened, even the fever stopped. She was unable then to get high fever again. And that's when we see a chronic inflammatory condition starting. It goes from acute to subacute to chronic. And then we like to see, we need to tell the patient at some point the fevers will come back. And this will be our real sign that things are much better. So 2 fevers, 2017, puts her into, it's relatively recent, puts her into a better group in my estimation, so probably group 2 somewhere, which gave us more hope for the treatment. It's possible, of course, that 2017, yes, when I saw her 2018, so it was only a year before she'd had the flu. So this puts her in a better group, actually. So I had some good hope here. Now I'll show you, I'll share the screen of the first, everybody can see that. The first rapidization I did with Compass, Vithoulkas Compass. Mainly her physical symptoms, the fistulas and this particular symptoms, and her issue with injustice, which I felt was really important behind this, her case. So we see here with this, it tells us that, of course, the remedy we must think of is Causticum aloe, because we know it has a lot of these types of inflammatory bowel symptoms. Staphysagria, because of injustice, and Causticum. Now, Causticum, I felt, was the correct remedy for her. It's a remedy that I've used quite a lot. I would say more than any other remedy. Maybe that's just a coincidence. Of all the inflammatory bowel conditions, especially ulcerative colitis, I've used Causticum probably 50% of the time, and it's quite totally different cases. So it seems to me to be a very important remedy in this condition. So I prescribed Causticum 30C in drops in liquid potency to take daily, but succussed every day with 5 succussions. So she would be able to take this on a regular basis, because she was still taking this immunosuppressant drug, although she'd reduced it. So this way we can continue the remedy, it won't get antidoted, and we continue until the patient has an aggravation, which of course we expect. With the right remedy, we expect an aggravation, and that can be what's difficult with these bowel conditions, because the aggravations can be hard to handle. And sometimes they end up back in hospital, and it all goes round again. So we have to be very careful. I wanted to keep the potency lowish, not too high in these conditions. You could use LM potency if you're used to those, and we'll see later on how I used that. So the effect was that she had an aggravation of symptoms on the 3rd day and then stopped the remedy. She had profuse sweats at night, soaking. She needed to change. Blood and mucus, and the frequency of the bowels was the same. So we waited a little bit, and she had a sensation of pressure downwards, somewhat more tenesmus, with explosive stools, with a lot of wind and blood and mucus. but she said the stools were a bit more formed. So we waited. Little changes, you wait. But we waited another 4 or 5 days, and she said there's no improvement at all. So in this situation, it's not possible to wait. We have to try to find something to calm down the reaction and the symptoms. So at this point, I went to, it's not on here actually, but anyway, some reason. I, almost like in an acute situation, I gave her aloe 30C to try and calm down these symptoms. She felt better for the first 2 days and then worse again. This was just a kind of placebo response. When we see this better and worse, it's usually placebo. So again, she said she was some more symptoms, better eating actually and worse fasting. In general, this is not the condition. She finds it very difficult to not eat and fast. She gets very shaky and weak. Cold feet is affected by both extremities of temperature, so cold and heat. Likes a nice moderate temperature. She had a strong desire for bread and butter, a cold tip of the nose, and salivation in sleep. So here we have an extrapolarization with some of these things added in. Salivation, you see some the original symptoms, fistula, sensitivity to heat and cold, and the bread and butter. And this brings us to another of the important remedies in inflammatory bowel conditions that, again, I've used a lot, very successfully. It's not showing results. Huh. What's happened here? Seems to have got stuck. Anyway, sorry, the screen seems to have got stuck. I think sometimes this happens because of Zoom. What can we do? I will have to, sorry, but I'm going to have to try to open this up again. Let me see if I can do that. Okay. Okay. Huh. Still not working. Okay. I don't know what's happened here. Screen. Okay. For some reason, it's not showing the repertorization. I don't know why that is. Says all remedies hidden by filter. I don't know what filter that is. Anyway, so but what that comes up with,
Andrew,
yes?
can you zoom out a little bit?
Zoom out.
Is there a zoom in? Can you zoom in?
What do you mean?
Just zoom out. Can you? Is it the Mac?
Yes.
Can you do Control-0 or something like that, or Control-?
Control-0. Oh, I see. I think it's Command.
Command. No, you still no.
There seems to be some sort of filter, which I don't understand. What filter this is? Hidden by filter. But this is not active.
Can you log out and log back in, please?
Yeah, I just did that.
Oh, you just did that.
Yeah. Anyway, we'll carry on because perhaps the other ones will be all right. But what this repertorization shows is Mercury solubus, which we can see from this repertorization. Mercury is one of our main remedies with inflammatory bowel conditions, and has these, you see symptoms here, sorry for bread and butter. It's one of the remedies we think of that has this difficulty in adapting to temperatures, and also all the bowel conditions, the salivation in sleep. So I told her to take Mercol 12C, keeping it very low, once a day against the cust, so that she could keep taking it. And then the effect of this was that she had a lot of liquid mucus with blood. Stools were more formed. There was a lot of wind and bleeding, involuntary bleeding and mucus. However, she felt that the tenesmus was less, so there was some improvement. Also, she had some mouth ulcers return, which was an old symptom, and some spots on her neck, both old symptoms returning, which for us is a good sign. So I said, let's wait, continue with the remedy. And this was she took this in April. And then by the end of May, following up, she still had blood and mucus with formed stools, involuntary loss of blood and mucus, offensive smell, urging, very urgent desire, can't get to the toilet in time, lots of accidents, explosive motions, can soil the whole toilet, can even miss the toilet and goes everywhere, floor, on the walls. It's like a rocket. Still some wind from the vagina, so this fistula is still there. Strong pressing down feeling in the rectum, needs to go many times in the morning. Soreness of the eyes, she had an inflamed Bartholin cyst, big appetite, but she's very, very thin, what I would consider more like a tubercular type, very tall and thin. Can't put on weight. So she'd also, I asked her about, we were aware of the accidents she'd had, road traffic accident, and then this fall at work where she injured her back. She'd also had, in the traffic accident, a concussion, and then the injury to her spine. And my thinking went towards with these symptoms, especially in the morning, with this explosive stool. So I put in many more symptoms this time. And everything that she'd told, injuries of the head, cold tip of the nose, forcible stool, shooting out, injuries of the spine. She had a very unrefreshed feeling in the mornings. She was worse in the afternoons. A couple of more general symptoms. Oh. Yeah, I'm sorry about this. I don't know.
Andrew?
Yeah.
Can you do me a favor? Can you change something in your repertorization? Can you say a degree? And then solve the case again, please?
Continue editing.
Yes, please.
Thank you.
You're welcome.
Good to have the experts on hand. Okay, so we see here, of course, Tukkum still, Mercury's back down here, silica, but we see here interesting remedy, natrum sulfuricum, which we know as a remedy for injuries of the head, but also the spine. We see here not just the back, it can be spinal injuries as well as hypericum, and many of the bowel symptoms. So my thinking was that maybe it was the injuries that really led to the start of this problem. And because of the severity of it, I decided this time to give a 200C one dose rather than a regular dose at the end of May. Now, here she had a big aggravation of the bowel symptoms. The potency was probably too high. Severe inflammation in the lower colon and rectum with explosive, slimy blood and wind, 20 times a day. So it got really severe after this. Pain and soreness, weakness, can't get to the toilet, accidents. So she was contacting me and saying, this is impossible situation. I may need to go in and get some help for this. So at this point, we need to do something. So I then gave her an acute prescription of this remedy that was coming second here, podophyllum, 200C, to try to ease this reaction. No effect of the remedy. Then I went back to mercury, no effect. But this took us some days to go through using these. Slowly, the symptoms started to ease by themselves and calm down. She said the stools became more formed, gas and mucus less. Urgency and accents went down to 5 times a day from 20. There was a desire for salt. So I think we come down to this one. See if this is the same. Ah, it's working now. Yeah, same one. And so in the beginning of July, I gave her that Solve. LM1. As we'd had an interesting, I mean, it was a severe reaction, but there was some improvements after, so big aggravation, and then improvement tells us the remedy is correct. So I but I decided to go on to LMs. She needed something regularly. So LM1 daily with 5 percussions. And this was the beginning of July. She had gradual improvement on the LM1 of the bowel symptoms. Much less gas and blood and mucus. And urging was down to 4 times, 3 in the morning, 1 in the afternoon. Generally feeling better in herself. This is what we like to hear. A person says, I feel better in myself. So I told her to continue. With the LMs, we can continue with this situation as long as things are improving, we continue. And then by the September, I don't know if I put it on here. Yeah. By the September, we went up to LM2 and still using 5 percussions. After the symptoms are better, but still there, some accidents, but not much. Still the fistula, sense of urging, generally worse in the morning and evening. So there was a certain degree of improvement with this, but I felt like things had stalled a bit. We were now into September. So I got some more information from her. I thought I would try to look at things more in general with her, try to find a remedy that suited her better rather than just the symptoms. She described herself as being very adventurous, liking to travel, liking company, irritable if hungry, better from a short sleep now. She felt she was a very sympathetic person, and she had food desires were clearer now, which was sausages she liked, and a recent craving, which was ice cream. Now, this was very interesting. Recent changes, very important to take note of, especially after a series of remedies. So we see then that the organism starts to produce some signs of the next remedy. So she was wanting ice cream all the time, and spicy foods and refreshing things, refreshing drinks. And she had this tall and thin build. So here we see symptoms. Her problem if she didn't eat, the low blood sugar, sympathetic, the abscess and fistulas, the bowel symptoms still, and the foods. Interesting rubric, this refreshing things. We have two rubrics that are very similar. One is refreshing things, which has more remedies. And we also have a, let me see, where are we? That's better. Just to show you carbonated drinks, where we have 4 remedies. Now there's a link between these two things. Often refreshing things doesn't have to be carbonated, but often those two things are very similar. When people say they want refreshing drinks, they want something fizzy. Fizzy and juice, refreshing is usually juice of some kind, but cold and refreshing, but also it can be a fizzy drink. And so we see here some remedies that also are in here. You know, phosphoric acid is one of the main remedies for refreshing, desires for refreshing, like fruit, refreshing fruit drinks. Also veratrum, cold, but also phosphorus. and natrum carbonicum and colchicum, both like carbonated. But anyway, she liked the refreshing things, so we had phosphorus coming up. Now, phosphorus, of course, is very similar in many ways to causticum, the original remedy I gave her. So I decided to give her, based on this repertorization, phosphorus. 30C, again in drops, succussed every day. This is the beginning of October. And she felt immediately, she said, lifted in her spirits after the second dose. Physically, she said the same. Rectal abscess starting to drain, discharging green mucus. Gas from vagina still, urgency 3 or 4 times a day. Blood, but less mucus, more control now. She noticed she'd become very thirsty for cold water, still wanting the refreshing things in the ice cream. Irritable if hungry. So I said, continue with the remedy. Then she developed a worsening of symptoms. So I told her to stop the remedy. After this, then she started to improve again, but still with some bad smelling gas and mucus, slimy mucus, urgency, hungry very often, needing to eat quickly. Otherwise she would get very irritable, low blood sugar, wanting fish, shellfish and oysters. So, I don't know if that's the last. That was the same one. I think that's just a prescription. Yeah, that's just the follow-up. Okay. So what I did at that point, realizing that phosphorus was the correct remedy for her at this stage, put her onto phosphorus LM1 on the 3rd of January 2019. The urging went down to 2 times a day. Very little blood, almost none. Stools formed. At this point, she'd stopped the, I have to say, the azathioprine for some time. So she was on no drugs at this point. She'd managed to come off them. Very little blood, stools formed, eating everything now with no problem. And then this is the interesting bit I was talking about. After 2 weeks, so we're talking in towards the end of January 2019, she developed a cold, like a flu with sweats, chills, and a fever of 39 degrees. And this is the sign that we need, that she has shifted level, that this inflammatory condition now is in a safer place because the acute inflammation is coming. And we see the symptoms generally improving. Still some gas from the vagina, perianal abscess, draining, still greenish pus, dreams of injustice and indignant anger about the past, always hungry, wanting sweets. So we continued onto phosphorus LM2 in the end of January 19. She developed another acute, but this time with no fever. Bowels stable, urge only 3 times a day in the morning, nothing in the rest of the day, no bleeding anymore. Still some gas, but no mucus or bleeding now. No accidents, and the abscess has healed up, stopped discharging. So then we're going on to the end of March 2019. And she says, bowel motions are good, formed stool, no bleeding, tiny bit of mucus, sometimes abscess is healed. Another cold and acute, eating everything with no problem, still wanting cold water, refreshing things and fizzy drinks. Now, a strong craving for fizzy drinks. And she had this, at this point, this weakness, energy, tiredness, probably due to all the loss of fluids she'd had over the years. Okay, let's try this trick. Yeah, and we see phosphoric acid indicated for these symptoms. So at this point, I changed to phosphoric acid LM1 on the 1st of April 2019. And she sent me an email. She says, "Hi, Andrew, I'm feeling much better overall. The vaginal fistula feels as if it's finally healed. No more gas passing through. No more discharge. The one above the anus feels fine. Virtually no gas passing, no pain. I hardly have any blood anymore. Soft, easy, formed stools. Slightly more energy, although still tendency to get over enthusiastic, doing too much and then feeling exhausted. Happened to me yesterday. Had a fun, busy weekend. I got a sore throat. Here we are in May 2019. Aching all over. My temperature went to 38.9. So again, another acute come with high fever. Very good sign for us. I'm ordering the LM2 today. So she went on to phosphoric acid LM2. And we followed up in the beginning of June 2019, regular bowel motions now, no gas, no mucus, no frequency or urging, fistula healed, abscess healed, eating everything, can even eat gluten now with no problem. Bread, cold sore came on the upper lip, which is an old symptom. And she had a sore throat this time, but with no fever. And that was the last follow-up, official follow-up. Although, as I said, I've been following her now the last few years because of treating her family. And she sent me a testimonial to say, Andrew has treated me for Crohn's disease over the past year or so. I was suffering a flare-up with unbearable symptoms when I first got in touch with them, having been on strong medication for 10 years and suffered many, many severe flare-ups. I'm presently delighted to be completely drug-free and symptom-free. It took a lot of faith and courage on my behalf in the beginning, as there were some scary moments during the process, and I almost panicked and went back to the steroids, but Andrew was always there throughout and always in touch. After a while, I could see gradual improvements and things continued to get better. Andrew is incredibly experienced and confident. He really believed he could help me. I trusted him, and he supported me with both my young sons and has cured ear infections where antibiotics had failed. Thank you. So that was the last thing. And as I said, I spoke to her probably a couple of weeks ago. So we're looking, 3 years on from that. And she's absolutely fine. And she has no symptoms, perfectly well. And she, as I said, has becoming quite a well-known artist now and producing beautiful flower paintings in watercolors and things. It's great to see. So yeah, this was the case. Rather convoluted case, but this is what happens with these conditions. You go 2 steps forward, 1 back. You have to sometimes intervene with acute remedies, try to manage the symptoms until you get on the right track. You can find it took many months before I was able to see phosphorus as her, if you like, more constitutional remedy. That really helped her, but she needed the nat sulph before, the mercury and the nat sulph, just in order to her to be able to produce a clear picture. So it's often in these cases a series of remedies that are needed. And we have a successful outcome. So, I think we can stop that share now, and we can start to have a look at answer some questions if Elena would like to.
Sorry, I forgot to unmute myself. Okay, first of all, Gary, thank you so much for this introduction to this webinar as usual, and for your wonderful support and contribution to these webinar series. It is really a pleasure for us and an honor to work with you. And Andrew, thank you so much yet again for such a fantastic and really interesting case. Your lecture was really very, very good for us all. There are a few questions, not very many, but a few. And let me start with the first one, which is from Dr. K. N. Rama. And he asks, why not give causticum 200?
In the beginning.
In the beginning, yeah.
Yeah. In these inflammatory bowel conditions, you have to be very careful not to go too high in potency. The aggravations can be severe. So that's the reason. I wanted to keep it low, 30. And actually we saw that the optimum potency for her was LM. It's a gentle, LM is a gentle effect. You don't get the aggravations that you'll see often with a 200C. So in this condition, you don't want to be sending them back to hospital. So you need to be gradual and slow.
Okay, thank you, Andrew, for that. Magdalena asks the following: why didn't you use from the beginning 30C, since it is a chronic problem with not such a clear remedy?
I think I did. I think the first remedy was cost 30. Yeah.
Well, okay.
I'm not sure quite what she means by that.
Okay, so let's go on to the next one.
Yeah.
Mayor Darani asks if the following: do we really need mercury, or would have natrum sulfuricum have helped from the beginning? Is natrum, okay, answer that and then I'll ask you the rest.
These speculations are always interesting, and it's true, but we can't really answer that because that's not what happened. Was the mercury necessary? It had an effect, but not really curative. So true, maybe if I'd seen the nat sulph or thought of it before, but actually the symptoms didn't come clearly to me until after the mercury. So sometimes one remedy leads to another. So, you know, at that point we were firefighting, trying to control these symptoms. So possibly, yes, we'll never know.
Yeah, and then he goes on to ask, is natrium sulfuricum a layer from injury?
Yes, I do believe the injury was what triggered off her condition, whether it was based on a basis of head injury and then head injury, and then of course all the anti-inflammatories, which then may have started the problem off. It's a little difficult to be clear on the causation in this case. Also, she had the injustice, so I'm not sure, but certainly the injuries were important, and we saw that the nat sulf is what really started to improve the case.
And then he goes on to ask whether then when was injustice ailments from noticed?
Oh, from the beginning.
Ah,
Yeah.
okay.
Yeah.
Okay, and then we have Naima, and she asks, do you have your patient's sucrose in the remedy bottle or in some other way?
Just the dropper bottle itself, they succuss, because it's a preparation like what's called a medicated liquid potency. So it's like 20% alcohol and water, 80% in the remedy. So it's like you just succuss the bottle itself and take from that bottle.
Okay. Then we have Liz LaRocca, and she asks, how were the acutes addressed? Did she continue to take the phosphorus LM during these acutes?
How were the acutes addressed? Oh, the flus and the sore throats. Nothing. I told her to do nothing. It's very important in these, when we get these acutes back, that you don't suppress them. So there was no treatment conventionally and no treatment homeopathically. I just said you have to go through it. She did. And with great results, you see, once those fevers came back, the inflammation, chronic inflammation disappeared. So again, we see this time and time again, transference from chronic inflammation to acute. It's important, don't suppress the acutes.
Okay. Yeah.
Yes, she continued with the phosphorus during the acutes.
Right. Now, Misha Oberleiner asks, at which point did she stop prednisolone?
The prednisolone she'd stopped previously, before seeing me. That was her treatment, been on for 10 years. And mesalazine. The drug that she was on when I saw her was the azathioprine, which she had reduced, and then she stopped it after some months of our treatment, once things were under control and improving.
Okay, and now we have Harinder Mann, and he asks, what's the method of using LMs? Can it be taken for daily for months?
Yes, months and months. Yes, the method is, my understanding of it is, as things are improving, of course you have to have the right remedy, but as things are improving, you just continue every day, succussing, raising, then maybe going from, we did LM1 to LM2, LM3, all the way, sometimes can be months, until you get to the point that Hahnemann described, where there may be a slight aggravation, then you stop. In her case, we didn't see that. She just improved and then stopped the remedy. Once the symptoms had gone, we stopped.
Okay. Ramona Popescu asks, well, basically, she doesn't ask anything. She's just congratulating you on a fantastic case. Sorry, it wasn't a question. Sorry.
It was convoluted, and but these cases often are. They're not simple, and you know, I like to show all the errors and mistakes that we make, because we make these mistakes. We give things that don't work. We give things that maybe worsen things. But as long as we stick with the principles and know what we're doing, we can get back on track and help people.
Jay Burgle asks, why did you grade bread and butter as high as 3?
Because it's a good question, because it was a recent craving, like the ice cream with the phosphorus. So when a craving comes strongly and more recent, you emphasize it more.
Okay, and Ashraf Sharafi asks, if you would have given phosphorus the first time, would it have been quicker to treat the condition?
Yeah, if I'd seen it. But you see, giving phosphorus in the beginning probably wouldn't have helped. You need a series of remedies. You see, that's looking in hindsight, isn't it? And saying, well, maybe it would have helped. But at the time, it wasn't indicated. She didn't have the refreshing drinks and the ice cream in the beginning. It was hidden. So it's like you take away some layers and then up comes the main remedy. So we can't really say that. We can't say it would have helped in the beginning. Probably not, actually. You have to give the right remedy at the right time. That's the secret of homeopathy.
Yeah.
Simple, really. You know.
Yeah.
He says.
So now we have another question from Nadera, and the question is the following. Would you please explain further why it's important not to suppress the acute?
Because you've made a great effort to bring them from a lower level where they didn't have the acutes anymore in a chronic state into an acute, a higher level where acute inflammatory illnesses can happen again. And you don't want to stop that process, because then they're in a better level. If you suppress that process, they will drop back down to a low level. The chronic condition will start again. So it's really important they don't stop the acute, let the fever go as high as possible. Obviously, in some conditions, there may be a very serious acute which you need to intervene. If they have pneumonia, you can't just say, wait. You have to do something. But usually in those cases, the acute will be clear. There'll be a clear indication of a remedy. And in that case, you give it. You're justified to give it, and that will help. That actually will help the case progress. But if it's an acute that's not serious, I would say you have to just leave it. Let them go through it.
And she goes on to ask, sorry, just give me a second. She goes on to ask, how do you know the right remedy at the right time? Does this come with experience?
Yes, I mean, it comes with experience and materia medica knowledge, but also it comes with being patient. You can't, I think it's too easy to rush into giving too many remedies and complicate a case. You have to wait, let the organism, it needs time. Usually it needs time to bring out the symptoms. You see, and then only when you've got a really clear case, that's when the remedy will work. If you give too soon, you get disappointed and it doesn't work, and you change the remedy and you change the remedy, and then nothing happens and the patient leaves. You have to just wait and let the organism bring out the symptoms.
And now we have 2 more questions, which is Anna. Anna says that she did not hear very well how many times a day you gave the LMs.
Once a day.
Once a day. And Harrinder Mann goes on to ask the following: is she still taking the remedy?
No, not now. Nothing.
Okay, and I think that's it. We don't have anything else. We have, well, we have one more. It's from Varangana, and she asks, if given the right remedy, is it going, sorry, just let me go back a second. If given the right remedy, is it going to suppress or not the symptoms? If given the right remedy, is it going to suppress or not?
Does she mean the acutes, I think?
I presume, yes, she probably does, yeah.
It won't suppress. If you have a clear acute remedy and you give it, it won't suppress the case.
Okay, and that's about it. We don't have anything else. Everybody thanks you for a very interesting case from many parts of the world, including Canada, which I see here. Thank you from Canada. So you're all the way to going to Canada.
Yeah. Well, thank you everyone for joining this webinar.
And I pass on to Dr. Gary Smith.
Thank you. Thank you very much, Alina. And thank you, Andrew. And yes, congratulations. That was a tremendous case, a really amazing case. And I was thinking, you know, if there was a less experienced or patient practitioner, or indeed a less determined patient, the outcome could have been so different. But there's so many aspects there, and there's so many good questions that could could trigger many more discussions. And I would like to say, if you haven't, you know, that's a great case to write up, Andrew, and publish as a case report if the patient was willing. That's a fantastic case with such deep pathology that resolved after homeopathic treatment. So thank you, everyone. My conclusion is simply to thank Andrew and to thank Alina and Vithoulkas Compass. As I said earlier, if you're interested in Vithoulkas Compass, you can get a 20% discount by contacting Alina. And if you're a member of the Faculty of Homeopathy, you can get a 25% discount. And other benefits of being a member of the faculty is access to other webinars and other CPD material. If you're interested in research and you want to know what's going on in homeopathic research, then you should be subscribed to the Homeopathy Journal, the International Research Journal of the faculty. And there's two other events that I want you to put in your diary. One is the next installment in this series, which is this day, 6 weeks' time, Sunday the 27th of November. We'll be back again for the next installment of this series. So mark that in your diary, same time, same place. And the other event, which is a rather special event that I would like to mention to everyone before we close the webinar, is not until next year, next September, the 100th Faculty of Homeopathy Congress. The Faculty of Homeopathy has been around for 178 years, and it's been doing congresses for a little bit less than that. And the 100th Congress is coming up next September. It's going to be held in Cambridge in the UK over 3 days. Mark it in your diary and watch this space for more information. We'd love you all to come face to face to that event. So I don't think there's anything further to add. Thank you, Andrew. Thank you, Vithoulkas Compass, and thank you everyone for being here today. And I hope you enjoy the rest of your day. Thank you.
Thank you, Gary. Let me just add that we have had many people from all over the world: Japan, Mexico, Portugal, LA, Egypt, Sweden, Canada. So just because they sent us a message from there, I want to thank them very much on behalf of Vithoulkas Compass, on behalf of the faculty and of Andrew Ward for attending. Thank you very, very much.
Thank you very much, everyone.